everyone. How you doing? It's Dave Bondy. You would like to see all of the information that the CDC is collecting, correct? I'm sure all of you would like to see it. Well, there's a report out there that not all of the information is being made public. You need to go ahead and follow me right now so you don't miss any updates. Subscribe and make sure that you follow me. That way you'll get alerts as to when I post videos because, they don't put them out there all the time. Not everyone does. So let's get to this real quick. This is an article at midmichigannow.com, and you can read this. I have a description in the video right here where you can learn more. And my name is Dave Bondy, by the way. I'm a journalist. I'm a dad. I'm a guy who just keeps it real and unbiased, no narrative, just giving you information. Got that out of the way. So this new report details how the CDC allegedly collected significant data, but only released a fraction of it. Let's look into this article a little bit here and learn more about what we're talking about. This is from Mid-Michigan Now and the National Desk. From COVID-19 cases, hospitalizations, and deaths to variants and vaccinations, medical experts assert mounting the most effective campaign is directly tied to data. Let me look at this right here. Data and surveillance information is really the lifeblood of public health efforts, says Josh McCaud, Associate Director for Global Health Policy at the Kaiser Family Foundation. But the agency tasked with collecting and releasing that data is now under fire after a new report. The New York Times, now it's the New York Times is reporting. New York Times is not just some random agency. The New York Times is reporting that 2 full years into the pandemic, the agency leading the country's response to the public health emergency has published only a tiny fraction of the data it has collected. It also states information on hospitalizations and death by age and vaccination status would have helped inform whether healthy adults needed booster shots. The journalist who wrote the article spoke to CBS News about the findings. And right here, let me move this up a little more where you can learn more. The CDC didn't want to get some of these data out because they were worried they would be misinterpreted. And all the experts we spoke to said that is a terrible reason. So the reason why, according to this article, is that the CDC, according to the article, I'm not saying this, that the article says that the author in the New York Times said that the CDC did not want to give out this information because it could be misinterpreted. So there you go. It does not look like the CDC was reached for comment in this story. The CDC also saying, by the way, that COVID-19 vaccines are safe, they are effective, and people should get them. But this story right here is saying that the CDC has collected significant amounts of data, but they have not released it all. That goes into play on a story that I've been working on for years, the last couple of years, the state of Michigan. Did you know that the state of Michigan does not release? They may not even keep track of it. If they do, I don't know. They say they don't, or they don't have the information about comorbidities. Do you die with COVID or you die from COVID? The state of Michigan's not releasing that. There's other states out there that list, for example, Alabama, North Carolina, I believe. In those states, they list all of the COVID deaths, and they will list died with a comorbidity, an underlying cause, basically. They died, they had cancer, they were obese, and that led to their death with COVID or from COVID. The state of Michigan doesn't do that. They just put out COVID deaths, and they don't put out comorbidities. I've been asking the state of Michigan for a long time, but they say they don't do this because there's an issue collecting the data. Okay. And this is where it all comes in. All of you, that's for all of you to make your decision. And I give you the information. I have been digging deep trying to get it, and that's what's happening. So I'm going to talk to all of you later. Go ahead, subscribe to my YouTube channel. Go to midmichigannow.com to learn to learn much more. And be sure to watch Mid-Michigan Now on NBC 25 and Fox 66. You will see me anchoring at 10 o'clock. Have a good day.